On Friday's 209 figures, Joe, why do you think we're not being given an indication of how many of those 209 have recovered and are no longer deemed to be a risk to the public?
Yeah, if you look at the global figure, what they're saying is more than half of the people that have been, diagnosed with COVID have returned to full health. You see many people on, I suppose, the airwaves now that would have got it, like, you see celebrities like Ryan Tuberty or Claire Byrne, like having, had a case of COVID and having recovered fully, and they're back, at their workstations. And, like typically, it's a disease that does affect the old and the sick and people with underlying medical conditions. And in the main, it doesn't affect younger people to the same extent, or people in their full health. So I suppose it is important, that we would be given that information, but to hand, no, I just don't have it.
Yeah.
These people are up to their eyes in work, like trying to fight the pandemic, and obviously that information will be given to us at some stage, but not to hand at the moment.
And in saying that, Joe, that the most vulnerable are generally the elderly, is it strange then in a way that so little supports were put in place in advance for nursing homes?
Yeah, like there are issues in relation to nursing homes, and government has worked with the HSE to provide the necessary public the PPE for them, and they provided a new package of supports as well for nursing homes, advice and support and staffing as well. And I've received representations in relation to that. I've fed it back up the line. We were slow to deal with this issue, but I believe that we are now in a position where those supports are being delivered on the ground in nursing homes. It's unfortunate that it did take a period of time for that to happen.
And Joe, are you happy with the amount of information that is being given to the public by health officials and the HSE and the Department of Health?
Yeah, I'd have to say that I am. I think it's very comprehensive. I think Dr. Tony Holohan, the CMO, I think he's a wonderful communicator. He comes out every evening, and we have a lot of medics as well, and you get to know who they are, and I have a lot of confidence in what to say and the information that they give and the advice that they give, and I have to compliment people for embracing that advice, and having taken this very seriously in terms of social distancing, in terms of not going beyond the 2-kilometre rule from your house, trying to exercise the cough etiquette, all that stuff, and basically to stay at home and stay safe. And it is difficult for families. It's very difficult, in particular for people over 70 who have to cocoon. It's difficult, but I think the reward is much more greater, in that all our efforts are paying off. They're saving lives. We're stopping the spread of the virus, and that's clearly evident in all the different stats that are coming back. There's less people going into hospital. There's less people going into our ICUs. Or hospital systems aren't being overwhelmed like they were in other jurisdictions, with tragic consequences for them. So we are winning the battle, but I still encourage people to adhere to all the different protocols until the restrictions are changed. And it is difficult. It's very good weather out there, and you hear different anecdotal reports about a lot more movement of traffic. Even today now, people were saying that to me quite a bit, like that there's a lot more traffic around, a lot more people around. And I think it's important that we would, even as hard as it is, we just need to continue in this effort, to support our frontline workers, in particular the people in our hospitals on the front line, who are putting their lives at risk to save others. And I think it would be disrespectful of us if we were to break those rules and didn't adhere to them.